How often do you go to the doctor for regular checkups? If you're diligent, maybe once or twice a year, right? But what if I told you that there are lots of quick, easy, and accurate health tests you can do right at home whenever you want? Keep watching to find out more. Number 1. Check your heart and lungs. Your heart and lung function largely determine the health of your entire system. So, if something goes wrong with your heart or lungs, you can wind up with all kinds of serious problems. That's why it's crucial to check them regularly. To do that at home, bring your hands together so that your index fingers form an upside-down J. Hold them with the nails touching for about 10 seconds. Do you see a tiny rhombus in the negative space between your nails? Great! Your heart and lungs are A-OK. If there's no rhombus there, it may be a sign of nail clubbing. This is basically a deformity of the fingers that's associated with a number of heart and lung diseases. According to the Mayo Clinic, nail clubbing is often the result of low oxygen in the blood, which indicates certain lung problems. If you want to make double sure that your heart and lungs are doing fine, there's one more test you can try. Just climb about 8 to 12 stairs while singing a song or talking on the phone. If by the 12th step you feel like your heart is about to jump out of your chest and you can't catch a breath, it's another red flag that your heart or lungs may be struggling. So don't hesitate to see a doctor. They'll tell you exactly what you're dealing with and help you get your health back on track. Number 2. Check your brain health. Little slips in brain function are dangerous because they can be hard to detect. Yet they get more and more serious over time. Luckily, experts from the Kyoto University Graduate School of Medicine know exactly what to do. According to their study, your ability to balance on one leg can easily help you check your brain health. All you have to do is lift one of your legs so that the raised knee is in line with your hip. Try to hold this position for 20 seconds. If you can do this almost effortlessly, your blood vessels and brain must be in great shape. However, if you find it difficult to hold your leg up like this, it may indicate an increased risk for brain disease and cognitive decline. Again, visiting your doctor is an absolute must. Number 3. Check for anemia. Stand in front of a mirror and pull your lower eyelid down a bit. Stick out your tongue if you want to. The exposed tissue should be bright pink. If it's a pale light pink or even slightly yellow, you could be anemic. Anemia is a condition when the blood doesn't have enough red blood cells, aka hemoglobin, in it. The dangerous thing about anemia is that it prevents all the other tissues in your body from getting enough oxygen, which in turn hurts their function. Other major indicators of anemia are constantly or quickly feeling fatigued, loss of energy, shortness of breath during exercising or even going up the stairs, pale skin, and insomnia. If you have these warning signs, it's definitely time to see a doctor. Number 4. Check your hormone levels. The best way to keep your hormone levels in check is to pay attention to your daily hair loss. Doctors say that it's completely normal to shed between 50 to 100 hairs a day. If you're afraid that you lose more than that, just try this little experiment. First, make sure your hair is clean and dry. Now grab a small lock of hair and pull at it just slightly. If you end up with 2 to 3 strands in your fingers, there's no need to worry. Your hormones are doing great. Pulling more hairs out could mean that it's time to see a hair and scalp specialist. Hair loss can come from a variety of factors, including stress, improper hair care, and serious health problems. Hormonal imbalance plays a huge role here too, making your hair way thinner and more fragile. Don't ignore this symptom and make sure to take necessary action. Number 5. Check your nerves. One of the most common nerve conditions is something called carpal tunnel syndrome. It involves pain in the hands and fingers due to a compressed nerve in the wrist. This condition is common among artists, motorcyclists, and those who type on the computer a lot, like office workers. To check yourself, start by raising your arms and make 2 fists in front of your face. Your wrists should be facing toward you. Now try to reach the bottom of your palm with your fingertips and hold this position for about 1 minute. If you start to feel tension, pain, or unpleasant tingling, you could have carpal tunnel syndrome. If you're thinking that's probably the case, you really must visit your doctor as soon as possible. Carpal tunnel syndrome only gets worse over time, so a proper diagnosis during the early stages can really make a difference. Number 6. Check your blood sugar. High blood sugar is never a good sign, but one of the most dangerous things it can lead to is diabetic neuropathy. This condition occurs when high blood sugar starts to damage nerves in the body, and it usually targets the legs and feet. To check your blood sugar levels, you'll need a pencil and the helping hand of another person. Ask your friend to touch your feet and toes with both the pointy end and the eraser side of the pencil. Really focus on how you feel and answer one simple question. Can you tell the ends apart without looking? If it's a piece of cake for you, then diabetic neuropathy isn't something you should worry about. But if you don't feel any difference between the 2 ends of the pencil, this means that the nerve endings in your feet aren't working to their fullest. Apart from this alarming sign, other symptoms of diabetic neuropathy include pain and numbness in the legs and feet, as well as digestive issues. That's why the earlier this problem gets treated, the better. Number 7. Check your arteries. Lie down on your back, raise your legs at a 45-degree angle, and hold it for about 1 to 2 minutes. When the time's up, take a closer look at the color of your feet and toes. Are they pale or even white? If so, then you might have a circulatory problem that's narrowing your arteries and thus reducing the blood flow to your legs. In the medical world, this condition is called peripheral artery disease, and it can sometimes affect only one leg. So if you see that one or both of your legs became pale, answer a few more questions. Do your legs become numb and weak pretty quickly? Is it hard for you to walk at times? If your answers are mostly yes, you should definitely see your doctor ASAP. According to the Mayo Clinic, peripheral artery disease can be a sign of atherosclerosis, which is known to reduce blood flow to the heart and brain. Number 8. Check your hearing. Whether we like it or not, our hearing gets worse with age. But these changes can sometimes happen way earlier than you expect. To make sure that your hearing is still going strong, go into a quiet room and gently rub your thumb on the other 4 fingers. Start by doing it pretty close to your ear, and then slowly move your hand further away until it's about 6 inches from your ear. If you can hear the rubbing that far away, your hearing is still impeccable. Just don't forget to check the other ear as well. Of course, if you notice that the further away you move your hand, the less you can hear, you should definitely check with your doctor to find out if you're already starting to experience hearing loss. Do you know any other quick and easy health tests that really work? Let everybody know down in the comments. Don't forget to give this video a like, share it with your friends, and click subscribe to stay on the bright side of life.